talk about osteoporosis and bone disease today with Dr. David Fultz from Kliamovich Chiropractic with offices in Sweet Valley and Shavertown. Dr. Fultz, great to have you back on the show.
Thanks for having me.
Well, for those who are not familiar with it, give us a little bit of a background of what osteoporosis is.
Well, osteoporosis is a severe loss in bone density in a patient. Osteopenia is just an earlier form of osteoporosis. It's not quite as severe. When people are young, they usually have strong, healthy bones. They're pretty resistant to breaking. It takes a great deal of force to cause damage to the bones. As you get older, some people develop osteoporosis. It makes it easier for bones to break or fracture.
Tell us a little bit about who is most at risk for getting osteoporosis.
Well, women are specifically at greater risk for osteoporosis. Small women are even more at risk. Smokers are at a greater risk for developing osteoporosis. The longer you've been smoking, the more you smoke, that all contributes to your risk for developing osteoporosis. As people age, you'll develop a greater risk for osteoporosis. Everybody loses a little bit of bone density as you age, and older women are definitely at a greater risk for osteoporosis, especially after menopause when their estrogen levels drop in the body.
Now, we know certain afflictions like heart disease tend to be hereditary. Is that the same for osteoporosis?
Yes, it is. Osteoporosis is hereditary, so if you do have somebody in your family, especially if they're in your immediate family, you need to take extra precautions against osteoporosis. People who have somebody in the family with it and they don't have a very active lifestyle, they're at a very increased chance of developing osteoporosis, because if you don't put force onto the bones, if you don't tax the bones, they're going to lose bone density because they don't respond to pressure that often.
Now, just like with heart disease, there are things you can do to help prevent osteoporosis, even if you stand a better chance of getting it. What are some things that you can do?
The first thing you need to do is, if you smoke, you need to stop smoking. And especially if you've been smoking for a long time and you smoke a lot, this is going to increase your chances of getting osteoporosis a lot. So you need to stop smoking. That's the first thing. If you have an inactive lifestyle, you need to do some weight-bearing exercises. By weight-bearing, I mean you need to have your full body weight on your feet, whether that's walking, running, dancing, weightlifting, anything like that where it's going to cause a bone response. And the last thing you need to do is increase your calcium and vitamin D intake in your diet, because those are two things that will help to strengthen your bones and keep them healthy throughout your life.
All right, for our viewers that would like additional information, how can they get in contact with you?
They can contact us on our website at kcopro.com or call the number on the screen.
All right, Dr. David Fultz from Kliamovich Chiropractic with offices in Sweet Valley and Shavertown. Thanks so much for joining us. We'll see you again next time.
Thanks for having us.
For today's social media question of the day.